Colistimethate Vial is an antibiotic medication used to treat specific bacterial infections. It works by halting the growth of bacteria. This medication is typically administered by a healthcare professional through injection into a vein or muscle. It is important to follow your doctor's instructions carefully and complete the full course of treatment. The dosage and frequency of administration will be determined by your doctor based on your medical condition and response to treatment. Be sure to take this medication at the same time each day to maintain a consistent level in your body. If you have any questions or concerns about taking Colistimethate Vial, be sure to discuss them with your healthcare provider. When using Colistimethate Vial, it is important to follow your doctor's instructions for dosage and administration. If you are administering the medication at home, make sure to learn the proper preparation and usage from your healthcare professional. Before using the vial, check for any particles or discoloration, and do not use it if present. It's important to store and discard medical supplies safely. If you are inhaling the medication, learn how to prepare the solution and use the nebulizer machine correctly. Make sure to use the antibiotic at evenly spaced times for the best effect, and try to use it at the same time every day to help you remember. It's important to continue using the medication until the full prescribed amount is finished, even if your symptoms improve. Stopping the medication too early may cause the infection to return. If your condition does not improve or worsens, make sure to contact your doctor. If you experience stomach upset or itching, make sure to tell your doctor or pharmacist. It's important to remember that the benefit of this medication is greater than the risk of side effects. Many people using this medication do not have serious side effects. However, if you experience numbness or tingling, mental/mood changes, difficulty walking, trouble speaking, or signs of kidney problems, it's important to contact your doctor right away. This medication may rarely cause a severe intestinal condition, so if you develop diarrhea that doesn't stop or abdominal pain, make sure to contact your doctor. Additionally, prolonged use of this medication may result in a new infection, so be sure to tell your doctor if you notice any symptoms of a new infection. If you experience a serious allergic reaction, such as rash, swelling, severe dizziness, or trouble breathing, seek medical help immediately. If you notice any other effects not listed, contact your doctor or pharmacist. When using colistimethate, it's important to let your doctor know if you are allergic to it, polymyxin B, or colistin, or if you have any other allergies. This medication may contain inactive ingredients that can cause allergic reactions or other problems. It's important to discuss this with your pharmacist for more details. Before using this medication, make sure to inform your doctor or pharmacist about your medical history, especially if you have diseases of the nerves or muscles like myasthenia gravis, or if you have kidney disease. This drug may cause dizziness, and alcohol or marijuana can make it worse. It's important to avoid driving, using machinery, or doing anything that requires alertness until you can do it safely. Limiting alcoholic beverages is also recommended. If you are using marijuana, make sure to talk to your doctor about it. If you are planning to have surgery or any procedure requiring anesthesia or medications that block nerve or muscle activity, it's important to inform your doctor or dentist that you are using this medication. It's also important to note that this medication may cause live bacterial vaccines, such as the typhoid vaccine, to not work as well. Make sure to inform your healthcare professional that you are using this medication before having any immunizations or vaccinations. Older adults may be more sensitive to the side effects of this drug, especially when it comes to kidney problems. If you are pregnant, this medication should only be used when clearly needed. It's best to discuss the risks and benefits with your doctor. It is not known if this drug passes into breast milk, so it's important to consult your doctor before breastfeeding. When taking Colistimethate Vial, it's important to be aware of potential drug interactions that could affect how the medication works or increase the risk of serious side effects. It's essential to keep a list of all the products you use, including prescription/non-prescription drugs and herbal products, and share it with your doctor and pharmacist. Never start, stop, or change the dosage of any medicines without your doctor's approval. One product that may interact with Colistimethate Vial is cephalothin. Be sure to discuss any concerns or questions about potential drug interactions with your healthcare provider. If someone has taken too much Colistimethate Vial and is experiencing severe symptoms like passing out or difficulty breathing, it's important to seek immediate medical help. In the US, you can call your local poison control center at 1-800-222-1222. Canadian residents can call a provincial poison control center. Symptoms of an overdose may include extreme drowsiness, slow or shallow breathing, muscle weakness, and inability to move. It's important not to share this medication with others. Your doctor may also require you to have lab or medical tests, such as checking your kidney function, while you are using this medication. Make sure to keep all your medical and lab appointments and consult your doctor for more details. Remember to take each dose of Colistimethate Vial as prescribed by your doctor. If you miss an injection, talk to your doctor or pharmacist to get a new dosing schedule. Do not take a double dose to make up for the missed one. If you miss an inhaled dose, take it as soon as you remember. If it's almost time for your next dose, then just skip the missed one and take the next dose at the regular time. Do not take a double dose to make up for the missed one. When using Colistimethate injection, it's important to consult the product instructions and your pharmacist for storage details. If you are using Colistimethate as an inhalation, store the unmixed vials at room temperature. It's crucial not to use premixed solution or prepare the solution ahead of time, as this can lead to serious breathing problems. You should prepare the inhalation solution right before use and discard any unused solution after 24 hours. It's important to not store it for longer periods. Make sure to keep all medications away from children and pets and avoid storing them in the bathroom. Properly discard this product and it is expired or no longer needed, and consult your pharmacist or local waste disposal company for more details. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.